So I'm Jonathan Watts-Hull. I'm the Director for Student Success at the University System Office. I've been your host for much of this week. I'm really glad and grateful to have you all joining me here for a session that's really important and crucial to us. This is actually a session that when we started planning the Momentum Summit way back in late October, early October, we knew we needed to have we knew we were going to have a discussion about mental health and stress and wellness and sort of ways in which we need to support that. You know, even before the pandemic, there was a real concern about student mental health, about faculty stress and wellness, and about the ways in which we need to really engage to create these healthy, supportive communities. And I'm sad to say the pandemic really accelerated some of these needs. The system has also responded and responded in great kind, and institutions across the state have as well. And so I'm really grateful to be joined today by three good colleagues who are going to sort of provide a pretty good scope of overview of what's available. So I'm joined today by Karen Elliott. She's the Associate Vice Chancellor for Total Rewards, as well as Farah Williams. She's System Benefits Wellness Program Manager, and then Chip Reese, who's System Program Director, all here at the System Office. Who are going to sort of give us an overview of the work. And I'm going to start, I think we're going to start with Karen. And Karen, I'm going to quickly hand it off to y'all. I will say this, we have a chat. If you have questions as you go, we'll pop them in the chat and we'll get to them as they'll take questions at the end of the sessions. We'll take them throughout, but it's the best way to make sure that we get those questions checked on and answered. So just go ahead and find that chat box and use it. And with that, Karen, if you are prepared, we're ready to go.
Awesome. Thank you, Jonathan. I appreciate that. And good afternoon, everybody. Happy Friday. I'm Karen Elliott. As Jonathan said, I'm the Associate Vice Chancellor, Total Rewards. And basically what that means is that I'm over the benefit programs for the University System of Georgia. And so that encompasses all of our healthcare plans and retirement programs, but also the well-being program as well. And joined with Farah today, who works in our office. So we are so excited to be here and talk to you. When Jonathan invited us and mentioned he thought this would be a good topic, we jumped on the chance to speak to all of you. And so what we're going to talk about today, Farah, if you want to go ahead and go to the next slide, we're going to talk about really focus on mental health and the resources that we have today. So we're going to be going through all of those, and I'm going to start with just giving a little bit of a background about what we've been seeing in some of our data surrounding mental health, but we're also going to talk about what we're working on in our office as well. Just as Jonathan said, with the pandemic, it's really been top of mind with everybody working, remotely. It's almost been a year now, and thinking a lot about that. In 2 weeks, it was kind of the point where everybody went home and started working from home, and just everything that came with all of that. So we've been very mindful of that in our office and thinking about what we can do to support all of our faculty and staff. So that's what we'll be sharing with you today. And then, of course, we'll turn it over to Chip at the end, who will be going through what we're doing on the student mental health side. So if we could go to the next slide, Farah. As I mentioned, we've been really focused on employee mental.
I'm sorry, Karen, I think you got muted.
Okay, I don't know how that happened, but thank you, Jonathan. So as I mentioned, we started hearing from our campuses in our office just about the concerns that were coming from their employee population, and just looking at the data. We know that when we look at our healthcare data, that diagnosis and treatment for mental health has been growing over the past year when we look at those claims costs, but just across higher education institutions nationally. So this has been top of mind for us. 60% of college presidents nationally rank faculty and staff mental health as a top concern. That was from a recent survey from the American Council on Education. It came in November of 2020. And then just as we all know, all the challenges that we have in dealing with the impact of COVID-19, whether it's impacting your family or just having to be flexible and working from home and childcare responsibilities, and also just concerns about being tested and contacting COVID-19. So all of those stresses that we know all of us are experiencing as part of this. So next slide. As I mentioned, the data that we're looking at in the system office, so we do have a claims database system, which is we're able to look at conditions of our employee population. It's all de-identified, it's all at aggregate level. So we never look at individual employee data. Of course, we're not able to do that, and that information is not provided to us, but we get very high level aggregated data. And when we look at our employee population overall, we can see over the last 3 years that we see increases in the rates of depression and anxiety within our population. So these are the claims. And we see that over the last 3 years, rates of depression have increased by 20%, and rates of anxiety disorder have increased by 27%. 36% of USG employees. So some of the data that we also have is through our well-being program. And again, this is reported to us at an aggregate level. We do see that for those employees that are completing the health assessment, 36% of those in 2019 reported having high stress levels. So we're in the process right now of collecting that data for 2020, and we should have it very soon, but we expect to see that rate even higher with everything that was happening in 2020. And then of course, we're seeing behavioral health costs for USG insured employees. Over the last year, we've seen those costs increase by 15%. So it's kind of a good news story somewhat, in that we know employees are really, they're experiencing higher level of need, which is not good. But the good news is that they are seeking treatment options, and we're going to talk about some of those options that are available. But that is good news that they are seeking that treatment when it's needed. So I'm going to talk a little bit about what we're planning to help support our institutions and employees. Again, in our office, we really rely on our institution HR office to communicate to all of their employees on the campus, although we do some communication system-wide. But what we're working on in our office right now is putting together a resource guide and toolkit for our campuses. So this will be basically a guide that we will provide to our HR offices, and it will include many of the things that we talk about today, just to make sure our HR offices are aware of all the ways that all the programs that we have to support mental health, and giving them ideas of how to communicate to their employee population so employees are aware of it. And we're going to ask you some questions about some of the programs and to find out if you're aware of those. We really want to hear from you to see if you're aware of those. But and part of what we will be asking our institutions to do is do some institutional based mental health programming. So some in person, because some of the programs, a lot of the programs that we have are online. And so we want to make sure that there's actual training programs on our campuses, but also looking at training and programming for our supervisors to help them recognize and help employees who may be struggling with mental health. And Farah's going to talk about that at the end of, towards the end of the presentation. So we're looking at releasing that in sometime in the May-June timeframe. And again, it'll also give our institutions ideas about programming that they can implement on their campus to help employees who may be struggling. And so again, right now we're in the data collection where we are talking to different groups of employees. Any feedback that you want to share of what you're experiencing, please. We welcome that. Just put it in the chat as we go through this presentation, but really want to know, what are your needs? What are you hearing? What are you seeing? And as we're talking about the different resources today, just let us know if you have interacted or engaged with any of those resources and your experiences. We would love love to hear back from you. So again, we'll be talking about Anthem, Virgin Pulse, Kepro. We don't have Kaiser Permanente, but of course, you know, we are able to get data from our vendors, but also we're looking at state and national data. And with that, I am going to turn it over to Farah, who is going to talk about some of our vendor partnerships. Farah?
Thanks, Karen. Hi, all. Farah Williams, the System Benefits Wellness Program Manager. As many of you may know, I like to call myself your Benefits Wellness Program Manager because I'm truly here for all of you as faculty and staff and for our campus support as much as possible. And so anytime you need me in regards to well-being, please feel free to reach out. I'm always a partner and collaborator in any way possible with all the different departments and groups. So just want to say that. And then in regards to Kepro, so Kepro is our employee assistance program. And what I like to say about Kepro is they're more than just an employee assistance program. I like to call them my personal assistant. Not to be confused with your personal health assistant, which is our Accolade team, but what I have found with Kepro is, yes, they offer us support around stress and anxiety, depression, and they can offer management counseling sessions as well if you are in a manager or director role. But what I have found is, you know, we have up to 4 sessions per counseling issue at no cost to the individual. And that's not just the individual, that's anyone within the employee's household. So this is for all employees that work 20 or more hours a week and anyone within their household. And while I call them my personal assistant is because I don't always need them for stress, anxiety, or depression, but I may need them for a tree went down and I need someone to come, you know, cut it up, take it away. And I'm working all day, you're working all day. And it's sometimes hard to balance our work and life, right? And so it's beautiful when you can call someone else and say, hey, can you help me find someone to come cut that tree up and take it away? They do all the legwork for you because sometimes that's the burden part is us finding someone to help us with balancing our work life. Or right now, a lot of you are balancing childcare or elder care, etc. And so they can help you find assistance in all of those areas. And so you can always go to their website and use the company code USG Cares or contact the 1-800 number. And it's 24/7, 365. And I want to share with you that a resource that goes over more about what they have to offer. So I'm putting that in the chat for you to review. And this is the EAP, my website's not pulling up, EAP services. So there's more, again, around work-life balance. They have, you know, legal services, financial services. I've just recently learned that with the tax season that they offer tax support as well, and there's a discount for it. They have articles and resources that can support you in different areas of life. Again, management, organizational services. And I know another thing that recently I've used them for was I recently had an incident of COVID in my household. And so in the midst of me trying to work and balance all those healthcare needs, I was able to reach out to them and say, hey, what's happening around this and how can I be better prepared as a caretaker or even provide support for my other half to prepare for what's about to happen in our lives. And so they were able to pull a lot of support group information, tools and resources to learn more about the incident. And so it's really, really beneficial for all of us to utilize Kepro. And I like to say, if we can learn to use Kepro on our day-to-day basis within our lives, then when we are stressed or depressed or have that anxiety, then we're going to be more likely to use them. It never fails that when we're in those moments of crisis, we always forget what support is around us. And so if we can make Kepro part of our everyday lives, then when we are in the point of crisis, then we're going to be more likely to use them and feel more supported. And this is what the website looks like for Kepro. And I think it's very user-friendly, very interactive. As you can see, there's a tab for mental health. And you can see all the things that they have available. They have also recorded webinars that are available that you can always go in and take part in as well. All right, so I have a question for you. Let's see. And launch polling. Look at me, Jonathan, I'm getting good.
So proud, so very proud.
Awesome. So yeah, if you all could just answer that question for us. Have you registered for USG Well-being and started earning USG Well-being credits? And 10 more seconds here. Ooh, looks like I'm gonna be contacting some of y'all. 3 seconds. All right, end polling. Oh, good. We're gonna end on a positive note here. Share results. So I think everyone can see that. Hopefully you can. As you can see, 53% said yes and 47% said no. So I'm gonna have to hunt y'all down and make sure that I'm able to assist you with registering your account, and hopefully you can start earning those credits. If you don't want to participate in USG Wellbeing platform, that's fine. Let's make sure that we're getting you engaged in other ways. As I love to say, there's more to it than just the platform. I don't like to say no to anyone. There's something for everyone in some way. All right, so now I think I just hit the X to close it out. So a little bit about USG Wellbeing in the partnership with Virgin Pulse. And so currently what we're doing, USG Wellbeing has established Wednesday virtual workshops around mental health and emotional well-being. So every Wednesday, and note, we do have a program called Well-being Wednesday, and that's once a month. And so for all those other Wednesdays, it's focused primarily around mental health and emotional well-being, and those are presented by Kepro. And you see the dates here, the topics, the times, and this is just March through May. So I'm going to make sure I'm sharing with you here another website. Where's the chat? Here's the website to the events page. I'm going to pass that. It looks like it's going to go to Jonathan so he can share that. But that events page shares with you everything that's planned for the year. And so it's not just Wednesday, mental health and emotional well-being. Every Tuesday is a well-being workshop. So whether that's physical activity, healthy eating, time management, because I know we talk a lot about mental health and emotional well-being, but the foundation of a lot of that is physical activity and healthy eating habits and just work-life balance again. And so all of those factors play a huge role into our mental health and emotional well-being. So it's important that I hope if you are sitting in your chair right now and you're at home, that you all can take just 3 seconds and stand up while you're listening to this part of the presentation, as I'm standing at my standing desk. And so it really plays a part of not being at our desk all day long sitting, that we're making sure we're taking those breaks and getting up and moving around for our own mental well-being. So I hope Jonathan shares that link with everyone. Awesome. And you'll see all the planned activities we have for the year. And that's constantly updated every week, every day. We also partner with Kennesaw State and Georgia State to offer chair yoga and healthy cooking demos, etc. So with Virgin Pulse and that partnership on the USG Well-being platform, we have opportunities as well, such as the USG Well-being phone coaching. And so if you participate in 4 or more of those phone coaching appointments, then you can earn a $25 well-being credits. Again, you don't have to stop at the 4. You're welcome to work with those coaches. And when you think about a well-being coach, I would love to hear what y'all think. But it's more than just health coach. And I'm sorry, my dog is coughing. But they have exercise physiologists to help you design a workout routine. They have registered dietitians to help you with your eating habits. They have behavioral specialists around stress and anxiety, depression. So please note that we do, again, I like to highlight the registered dietitian, because it never fails that someone's like, what? We have a registered dietitian that we can work with at no additional cost? Yes. So feel free to reach out and work with those phone coaches. And Journeys is a digital coaching. So some of us, we don't like to work directly with people. Sometimes we like to work on our health habits by ourselves. And so these are self-guided online programs that you can work on. So you can log into that USG Wellbeing platform. And my favorite one is Choose a New Attitude, because I know some of us are not always happy and want to hang out with everyone. Sometimes we need a new attitude, right? And so I've plugged into that one before, and they give you small baby step goals. So sometimes it's like, let's focus on the positive. Say one nice thing to somebody today. And so with these journeys, it's not something that you start today and finish today. It takes approximately 28 days to complete these journeys because it is a step-by-step changing your behavior, self-guided tool. And so it really helps you to take the baby steps and work on small goals to accomplish the bigger goal. But if you complete one of these journeys, you can earn a $10 well-being credits. I just saw that somebody's on a stationary bike. I'm so excited about that. Way to go. Awesome. And then another thing is we have the weekly well-being emails, and these emails are being sent from this email address, USG Well-being at mail.virgilpulse.com. And if you are not receiving those weekly emails, please let us know. We've worked very diligent with all of our point of contacts at all the institutions and IT teams trying to make sure that those emails are coming across. But there's a lot of great information in these emails. And as you can see, we promote weekly themes such as financial well-being. We have a challenge right now, Food Around the Globe. It's a virtual challenge to unlock recipes throughout the around the globe, but you're doing it with steps, and it's not just steps. You can log any physical activity and it will be converted into steps. So I hope you're participating in that. We do share a lot of mental health resources and emotional well-being in the daily live events that I mentioned earlier. So this is just a little shot of the email that came out on Monday to share with you. And I hope you're all getting a lot of great advice from those as we share that information. Well-being liaisons. So these are the point of contacts at each institution that I work with, and to share all of these great tools and resources. And they were presented to us from leadership at each institution. I work with them on a monthly basis to promote all the employee resources that we have available. They should be, I'm hoping that you're all seeing all of their communications because they are working very, very hard to try to share all of this with you. Again, they work with me every month and more because we're always working on all kinds of things to offer all of you, but also offering on-site screenings, flu shots, all the virtual events. And then they also have well-being committees and champion networks. And if you are interested in being a part of their well-being committee or well-being champion network, please reach out to your well-being liaison and let them know that you're interested, or you can reach out to me and I'll be happy to connect you with your well-being liaison. And this is how you can find your well-being liaison. And I'm going to share that link with everyone as well, because it's really important that we're connecting and partnering and we're all working together in this. As again, you're all faculty and staff and employees of the USG, so it's important for your well-being, but again, it's important for everyone's well-being around you as well. And remember that choose to your new attitude is not just about how we're interacting with maybe our coworkers, but sometimes how we're acting at home and sometimes how we're acting around the students. So it's very important for the culture of well-being to be established with all of us. All right, USG Well-being Mini-grants. And so we do have funding available to support the institutions. Up to $10,000 in well-being funding is available to every institution. I work again with all the well-being liaisons with these funds, but if you have some great ideas and things that you think would be beneficial for your campus to support the employees' well-being, again, please reach out to myself or your well-being liaison. We work with their well-being committees. We work with the well-being subcommittee at the system office level, and we work with a review committee that reviews all the proposals to establish so that they are SMART goals, in a sense that we are developing programs, implementing them, and making sure that they are measurable and attainable at the same time. But we are looking to create a sustainable environment which promotes physical activity, social and community engagement. We definitely want to achieve positive behavior change, and we want to encourage personal accountability for physical health and financial, social, and community well-being. That's very important. That we start taking that ownership and that we're able to guide our own well-being and those around us. But the one key thing that we're asking all of our institutions to do this year is that they must develop or implement an employee mental health program. And so, as Karen mentioned earlier, we are working on tools and resources to share with with all the institutions, and we will provide them guidance on how to develop and implement them. But we always need more support. If any of you are interested in helping us with that, we're welcome any and all hands to make that happen. All right, I'll pass it back over to Karen.
I had to unmute myself. Thank you, Farah. That was great. So I am going to go ahead and talk about some of the resources that we have available through the USG healthcare plan, specifically for those employees that are enrolled in Anthem Health, the Anthem healthcare plan. So that's, you may know it as Blue Cross Blue Shield. They changed their name to Anthem a couple of years ago. And so that's if you're enrolled in the comprehensive care plan, the consumer choice HSA, or the Blue Choice HMO plan. So these are some of the resources and tools that are available for you. So if we could go to the next slide. One thing, are we gonna do a poll question here? One of the things that we introduced this year, hopefully you have heard of this, but let's go ahead and just ask you right now, have you heard of Accolade, or have you already registered for Accolade if you're enrolled in one of the Anthem plans? I'm gonna give y'all a few minutes.
We'll give you 10 more seconds. And I would just like to say that I abuse Accolade now that we have them. I text them all the time. All right, 30 seconds.
All right. Well, I'm not too mad about that because they are new, and they are now the first point of contact for you if you're enrolled in one of the Anthem plans. And if you're not registered, I will ask you, if you're sitting there right now, to go ahead and you can go to their website, you can log in, register your account, and see all of the resources that are available for you. So this is brand new for USG for 2021, and it's a new strategy that we're employing. And again, it's to provide an extra resources for those employees that are enrolled in the Anthem plans to help them with navigating their healthcare. So if you've got any questions, and again, Farah mentioned that she's had a COVID family member, a family member that has had COVID. And so she's been utilizing all of the resources, but it would be if just you have any questions about, I'm trying to find a provider. I have a question about my benefits. I have a question about a claim. I don't think that it was paid correctly. So Farah, can you help put the link in the chat? Thank you. And so, but all the way up to, you know, I'm having problems getting a prescription. So they can do all of that for you. Once you call in the first time, they will assign a health assistant to you. And then every time that you call in, you will get that, you will be calling directly to that personal health assistant. And there's a whole team that works behind them. So if you need to talk to a nurse or need clinician advice or whatever you may need, they will connect you to those resources. Or if it's not within the healthcare plan, but there's resources through some of our other benefits, USG benefits, they will connect you to those benefits as well. So again, if you call in, you know, about needing to talk to a counselor, that type of thing, they will help you find providers. And I'll show you in just a moment what's available. So certainly I would recommend everybody, if you haven't already, to go ahead and go to Accolade and log in. Okay. And so I just wanted to go through, because I know it is very confusing and we do get feedback in our office about there's all these different vendors and I don't know where to go. But the one thing that we did set up with Accolade, you can register directly on their website, going through directly to the website. But one thing that you can also do is the enrollment, you can go ahead and there is a tile in the enrollment website where you enroll in your benefits during open enrollment. And so you can log in there. It's the one usgconnect.usg.edu. Click on Manage My Benefits, and you can log in, click on this tile, the Accolade Health Assistant. The first time that you click on that, it will require you to register. So you will have to register, but after that, after you register the first time, if you go in through the One USG Connect, when you click on that tile, it'll automatically enroll you into the Accolade website. So that's one way that you can go ahead and access your Accolade Health Assistant. Okay. And then wanted just to show you what it looks like once you log in. You know, there is a website, and we worked with Accolade to stand up this website with the different messages. And again, we do have the ability to feature certain benefit programs. And because of, you know, the overwhelming need that we're seeing in our employee population surrounding some of the stress and anxiety, that is one of our feature programs. One of the tiles, once you log into Accolade, that has information there. What are the resources? Again, we're talking about those today. Farah already mentioned Kepro, our employee assistance program that has the 4 free visits that are available. So, and also we'll talk about Live Health Online, which is a telehealth service as well that you can do via video chat. So, but then also you can see the health assessment is featured there. And then, you know, if you would like to talk to your health assistant, it has that information as well. One thing that Farah did not mention, and I'll just put a little plug in for her since it's right up here front and center. One thing that is new for our well-being program this year is that in order to earn the $100 well-being credit, and kudos to all of you that are out there doing your healthy activities so you can earn your credit. I do it every year as well. So I do, you know, it is money. You're leaving money on the table if you don't do it, but you will have to complete the health assessment this year. That's the baseline in order to be eligible to start earning that $100 well-being credit. So go ahead. Again, all that information is confidential. We do not receive any of your responses in our office. We do receive aggregate level data, but we never are, we are not allowed in the well-being vendor is Virgin Pulse. They are not allowed to provide individual data to our office. So it is completely confidential as you're completing that, that health assessment. So moving on. So Accolade now is replacing Anthem as your contact point for employees enrolled in the Anthem plans. And so there is provider search information when you're in the Accolade website, and there's you can see on the menu there is a section that says Find Care and My Providers. So there's, you can see just under this screenshot, popular searches for employees that have been out on the Accolade website that have registered. You can see mental health is one of those that is one of the more popular searches, which is good. We definitely want to encourage and reduce any kind of stigma related to mental health. So, and I think that is one of the great things about everything that's happening with the pandemic is people are really talking about kind of the stress and anxiety that people are going through. So by all means, we are encouraging, if you need that help, to go ahead and reach out. There are providers and it can help you. This provider search can help you with putting in, you know, those keywords that you'll need to search for a provider that is near you. And then also this, this screenshot, for those of you that like to use apps that are very technologically savvy, I have a lot of apps on my phone. I've logged in on my laptop through my computer, but I haven't downloaded the mobile app. I know Farah has, and she's very familiar with this, but you can see on the app as well that there's, if you look under mental health, and this is the same on the website, that'll give you a drop down of all the different practice areas that you can enter depending on what kind, what you may be going through and what you may be experiencing. So there's all of those options for you. Thank you, Farah, for putting that in the chat. Okay, and then again, Anthem, the provider network through Anthem is it's very extensive related to mental health specialists. So it's got psychologists, psychiatrists, professional counselors, licensed clinical social workers. So, depending on whatever your need is, there are providers in the network that you have access to through your healthcare benefits. So please do not hesitate to reach out. There's also inpatient and outpatient facilities for those, needing that extra level of care. So the very, very extensive benefits through the healthcare plan through Anthem. Okay. And then just wanted to talk about, I believe these are the last two slides that I will be covering, the Live Health Online. And if you haven't heard about Live Health Online, that is the telehealth option through the Anthem Blue Cross Blue Shield healthcare plans. And so if at any time, and we are encouraging everyone to be able to utilize this service. Right now, employees can use the Live Health Online at no cost, regardless of the plan that you're enrolled in. Just due to the pandemic, we did make that change in the healthcare plan. And so this gives you access, 24/7 access to a provider. It's generally for acute medical conditions. So something like, sore throat or earache, and they will write prescriptions. They do have, Live Health Online has two options under the mental health, category to help, if you would like to speak to a psychologist or licensed therapist, you can schedule an appointment with Live Health Online Psychology, and we've got the web link down there. So this would be for issues related to stress, anxiety, depression, relationship issues, grief, panic attacks, stress from coping with an illness, substance abuse, life transitions. So kind of just all of those, everyday life struggles that all of us are going through during this time. So certainly can be a resource and help if you feel like you really need someone to speak to. That Live Health Online option is available. As I mentioned, right now, there's no cost to all of USG employees to utilize these services just because of the pandemic. However, once the pandemic state of emergency is over, we will go back to the normal coverage under the healthcare plans, which under the normal plans, it would be covered. Our employees do receive up to 3 visits at a $0 copay. And that's for those that are enrolled in the Blue Choice HMO or comprehensive care plan. For employees that are enrolled in the Consumer Choice HSA, because of IRS rules, we can't pay first dollar healthcare costs due to the rules surrounding high deductible healthcare plans and eligibility for the HSA. So employees enrolled in that plan would be required to pay upfront for their visit until they reach the deductible, and then would be subject to a copay. So there's a screenshot of what that looks like, how you can schedule an appointment. Very easy, very convenient from the privacy of your home or in your office. But as always, if you experience a medical emergency, please call 911 or go to the emergency room.
If I can just share an example,
Yes.
I know that I've recently had some conversations with some employees at some of the institutions, and they spoke very highly of this program because even when they were in the office, they had a regular therapist. And so it was easier for them to go out to their car during their lunch hour and have their appointments with their therapist instead of trying to, again, have that work-life balance of leaving work, driving to the therapist, spending time with the therapist, and trying to get back to work or take care of family. And so it really is a convenient resource as well. So just want to highlight that.
Thanks, Farah. I appreciate that. And I will mention too that a lot of in-person doctor's office are offering a virtual option as well. So even if you had been seeing somebody in the past and already had a relationship and they're covered under the healthcare plan, a lot of those providers are offering a virtual option as well. So making it very convenient for all of us to get the care and resources that we need to support our mental health. So the other option under the Live Health Online that we did just want to mention is the Live Health Online Psychiatry. So this would be an appointment with a psychiatrist, which is able to prescribe medications. And so this is for those situations that may be a little bit more complex related to mental health. So could be, again, includes medication concerns, depression, but maybe those more serious conditions such as bipolar disorder or post-traumatic stress disorder, et cetera. So there is a different, you can see there is a web link directly to the Live Health Online Psychiatry. And again, the benefits are the same as what we covered under the Live Health Online Psychology. So again, great resources that are available for all of you. And then I'm going to turn it back over to Farah to talk about the resources available through Kaiser and then some of the training that we have available for our supervisors. And she's going to finish us out. So Farah, turning it back over to you.
Great job, Karen. Thank you.
Thank you.
Awesome. So if you took the time to sit down during that last part, then I encourage you to stand back up. And as we finish out this part, so for the Kaiser enrolled employees and some additional services, they do have some services that are available to the general population as well. But I want to highlight that members do have many ways to access mental health and care with Kaiser. They are very, very supportive in regards to mental health and emotional well-being. They've done a lot of work in this space over the last few years. But again, as a member, you do have the options of psychiatric or psychology care, as well as marriage and family therapists, addiction medicine, et cetera. And they've just been a true proponent in this. And so you can visit that kp.org mental health, and you can see a lot of tools and resources that they have available for you. Phone coaching. So I know I mentioned earlier the Virgin Pulse phone coaching. Kaiser does offer phone coaching for their members. That coaching does not count towards the credit. We were not able to outline our efforts, unfortunately, but I do encourage you to participate with their phone coaching as well, because again, their model is so amazing with having everything connected with your medical records. And so I do highly encourage that. They do also offer the virtual care, telephone and video chats, 24/7 nurse line, and meeting with a doc advice line. If you've never taken advantage of that advice line at 1 or 2 o'clock in the morning, I highly suggest it. They've been amazing to work with, especially during the COVID situation, as I recently indicated, experiencing. So very supportive. Behavioral health services. So if you've not gone out to the kp.org website, again, this is out there for just anyone. You can go right now and pull up this behavioral health services for Georgia. And, some of this is directly for the members, but even for general population, you can go out here and get a lot of tools and resources off of this site. Very informational and easy to share with others. So you can come out here, you see that they address many different mental health disorders, and they have some support online tools and how to connect, support groups, and then some other additional support information. And I wanted to highlight that something I recently learned is that they have something called, with their members resources area, they have like self-care apps. So these are apps for meditation, mindfulness, and cognitive behavioral therapy. They have self-care resources to help with managing depression, reduce stress, and improve sleep. Of course, they have the mental health tools and resources. I'll speak to you in just a moment about Find Your Words. They do also offer health classes and support groups and they have personalized healthy lifestyle programs. So I don't know if you're familiar with that, but especially when they are in person, they offer a lot of healthy lifestyle programs and classes at all of their locations. And a lot of them are for free, and sometimes they will allow the general population. I know one of their partnerships they have is with, I guess it's now Truist Stadium, and so they offer yoga, I think on Mondays or Wednesday nights, and right now they're doing it virtual, but that's offered to the general population, the entire community. So feel free to take advantage of that. But then they also have some employer resources. So if there's something specific that you want to do for your campus, they have support tools for that. They have a virtual and on-site mental health training offerings, taking care of yourself and your employees. It's a webinar, and I can share some of this additional document with Jonathan to send out as well. And they have a psychological healthy workplace webinar and a score sheet, and then workforce mental health insights such as a stress management toolkit, sleep management toolkit, and then some additional articles for support. They also offer on-site health classes. So if you've been at any of those institutions, I know that at UGA, we've hosted some classes. At the University System Office, we've hosted some classes at Clayton State and Atlanta Metro. So if that's something of interest, especially when we get back into person, and you are an institution within the Kaiser range, then I'm more than happy to work with you or your well-being liaison and HR teams to secure those on-site classes as well. So here's just sharing some more about those in-person classes and community support, therapy support groups, counseling sessions. And that's what I love about Kaiser is that they take really great care of their members, but they're a community partner as well. So don't be afraid to tap into them to see what they have available. They're online classes. And so for Kaiser members that may be on this call, or if you know someone that is a Kaiser member, what I like to share with them is that they have this thing called ClassPass. And ClassPass is online yoga, cardio, boot camp. You don't have to leave your home. They have over 4,000 online fitness classes, including cardio, dance, meditation, etc. And those are free to Kaiser members. And so just get into your Kaiser member, plug around, play in there, and you can tap into it. Or you can go to kp.org/exercise, and you can learn more about that ClassPass and how you can tap into that. So another program that they have, and this is all community-based, is Find Your Words. And I love Find Your Words. And if you can see my background, it says we're in this together, and we are in this together, right? In one way or another, we're all in this. So Find Your Words. And something I like to highlight about Find Your Words is it's designed to make it easier to open up about mental health and empower more people to ask for help, take action to help themselves and support others. Now more than ever, we all need the support to stay balanced, build resilience, and feel mentally and emotionally strong, whether it's clinical care, social support, or practicing self-care. And that's huge right now. Because sometimes we're not ready for clinical care yet, and we don't want to talk to a social group yet. But if we can practice self-care, that's huge in many ways. And so really think about the different avenues, and don't and that's a part about breaking the stigma of mental health and emotional well-being, is that if you're not ready to talk about it out loud, at least to get comfortable with talking to yourself about it first. And when you get confident and comfortable with building that within yourself, then it feels easier to talk about it with other people. And so that's what I love about Finding Your Words, is because we can share this resource out there. Let's see if I have another slide. Nope. We can share this resource out there. I will plug in, actually I have it pulled up. I will plug this for you. And you can get on there and share this and really help others. They can do an assessment and find out what their status is. Is it stress? Is it anxiety? Is it depression? Is it time to find that clinical support, or can I keep working on it on my own, kind of thing? Or maybe it's just, again, as we know, it's a baby step process. We can't push anybody to go get help if they're not ready for it. And so really allowing them that opportunity to dig inside themselves to get to that point. And so that's what I love about this site. But with my background and the link I just shared you, you can find your own background too. And so they have actual Zoom backgrounds in regards to breaking the stigma for mental health and emotional well-being. And so go to that link, download your new backdrop and start sharing that during some of your Zoom meetings and Microsoft Teams. I've uploaded to all the different platforms so that I can, it's conversation. And I log in and people are like, what does your background say? We're in this together. And I'm like, yeah, and it starts that conversation and it starts to break that stigma. And I'm able to share, hey, have you ever gone to this website? Find your words. And so I really want to just drop that in there for you all. You all can think about it and share it as you wish. If you have questions or concerns, let me know. I'm always happy to discuss any tools and resources to support in regards to those areas. Some other things that Kaiser Permanente has is around mental health and emotional well-being is some of their apps. And so you may have heard there's some commercials out now, especially during early in the pandemic, a lot of apps were free, right? Especially the fitness apps. But as this has progressed, we're seeing some more of the meditation and mental resilience and sleep apps become more available. But Kaiser's been having these available for their population. And so again, if you're a Kaiser member, log in, get into that member portal and look for these apps. You have free access to Calm and My Strength. If you've never tapped into My Strength, I highly suggest it. I know that I've used it before. They have a great assessment tool, again, kind of like the one on Find Your Words. But it's able to make it more tailored to you as well. And so you complete that assessment. It really lets you know, what are you thinking? What are you feeling? How are you managing that? What can you do better? And it allows you then to tap into those tools. They'll say, hey, have you thought about doing this tool or that tool? And so My Strength was a great partner in regards to, helping you manage that mental health piece sometimes. All right, supervisor and employee training. So Kepro, our employee assistance program, we have training hours available for every institution to utilize and offer programs that they have. They have an entire training catalog, but one that we want to highlight for you for the purpose of today's presentation was this mental health recognize and respond for managers. So this is a 1-hour seminar and you can request it through your well-being liaison or HR office and they will work with me. Or if you want to reach out to me and I can work with them, but they definitely need to be, you need to be building that relationship with them for sure, because they'll be able to assist you with all the other opportunities. But this is one of those programs we can offer to any manager group, director group, chair, department, deans, anything that you want to do around supporting how to start recognizing and responding to what we're seeing with some of these signs and symptoms of mental health and emotional well-being. You have to be mindful, right? You can't just be closed. You can't have your head down to the ground. You really need to have your head up and your eyes open and not just be concerned with yourself. You really need to be mindful of everyone around you, because you never know who's dealing with what and how can you be a supporting and not necessarily a friend, but a conduit in a sense. Like, how do you get them from point A to point B? And so many times you see people walk right by, and that's what we got to change. We got to start being partners with each other in life and recognize and support each other with tools and resources. But our Kepro point of contact is Becky Rosham, and she is our direct account manager at this point with Kepro. And so you can also reach out to her in regards to any trainings that they may have available. But again, this is out there. This is at no additional cost to the institutions. You can book this and get as many employees, managers, and directors into this training so that we can start establishing that. But to build off that, if you want something a little bit more intense and more, a lot more informational, mental health first aid at work, this is offered to us through our partnership with Kaiser. And so this does more than just managers and directors. This is for employees, but it's there to help recognize the potential of mental health issues. And what I love about this training is, yes, you do learn information about recognizing But you also get to practice that. And I know we got some members on here that's gone through this training a couple of times. I've hosted it for some of our well-being liaisons, committee members and champions. And so if you're on this call and you want to just share how great mental health first aid is, feel free to put in that chat and share with everyone your experience. But it was very touching. It did tap into you as an individual, but also as a professional, about how we need to support each other. And as you see, there is a cost to this associated, but we do have some funds available that we can support the institutions, the well-being liaisons, HR directors, our HR office, in supporting how we can get this training out there and support all of our employees and supervisors, etc. All right, any questions for Karen or myself?
So one thing I noted earlier up was from Lisa Adams. It's asking, is there a place on a website somewhere with all of these services and benefits and a short description of each, which would be super helpful.
Let's see here.
So that is a great question, and we are working on putting together a one-page flyer, which will include all of these resources. All of them are on our website, the USG Benefits website or USG Well-being website, in one place or another, but we are working on doing that. So great suggestion, and we will have that soon.
Danita Townsend just noted that she logged into Accolade and it took less than a few seconds.
That's great. Great news. Thank you.
I'm telling you, I have the app, and I think I text my personal health assistant every day. She probably thinks she's my new best friend. I'm like, I want a new provider here. I want a new provider there. Wait, I like this provider. Are they in network?
Anne asks if the Kepro 1 hour training she says it looks great. She doesn't ask if it looks great. She says it does look great. She says there is suggested class size for this course.
Typically those classes try to have at least 25 to 30 in the classes, just to keep it manageable, and so that it's a balance, so where it provides the opportunity to interact with others, but also it's manageable for the facilitator to try to connect with everyone.
And there was an early question about whether these slides will be available, and I've already said we're sharing them because you already shared them with me, so you don't have a choice anymore.
We've relinquished our right.
There's no copyright on it. I overshare.
No autographs today, please. All right. Well, we can pass it over to Chip. Thank you all so much.
Thank you, everyone.
Hi, guys. I hope
you just let me know when you want your polling questions.
All right, ma'am. I think probably just at the end will be fine when we get to the last slide. Farrah, you're driving, right?
I got you, Chip.
Okay. All right. Good deal. Hey, well, we're going to switch gears and talk about student mental health for a moment. And I know that we have employees on the line, but do want to give you an idea of what's happening out there, because many of you as faculty and staff are going to come in contact with students. And during that process, they have been in the past, and they will continue in a great way to ask you for advice, ask you for resources and what they should do maybe about a particular situation that they're going through. So we want to make sure that you guys understand, what is being offered out there. So next slide, please, ma'am. Farrah? Yeah, there you go. A little bit of background. As you can just see from this slide, over the last few years, the need for mental health on college campuses for students has just been increasing. And we've been working to try to keep up with that volume as we're moving through from year to year to year. But we just don't have the resources to keep up. You see kind of a baseline there on our pictograph that we have down there at the bottom. And that baseline is where we were when COVID really hit last March. Can you imagine? It's been right at a year ago since we first got involved with this. And you can see that what has jumped above the line for our counseling centers. This is data that was pulled from the Mental Health Task Force that I had an opportunity to be a part of, and then the Mental Health Initiative branched out from that. But you can see anxiety and depression and just the social connectedness issues that have really jumped up since COVID came on the scene again right at a year ago. Next slide, please, ma'am. We were given, you see here, $11.5 million, and this is part of the CARES Act, and the governor released the funds to his emergency relief fund to assist with in the university system of Georgia, to assist with some of the mental health issues that were taking place. This $11.5 million is really tied to COVID-related mental health, but we were already looking at that. If you'll go on to the next slide, Farron, we were already looking at what was taking place on our campuses. In fact, the chancellor had put the task force together back in October of 19, and part of that was that he was listening to the SGA officers. We meet quarterly with SGA from around the system, and over the last few years, they kept bringing to the table as well the need for more resources, and the chancellor heard that, and so put a task force together. Marion Frederick, president at Albany State, and then President Carvajal down at Valdosta were co-chairs of that. And in the midst of while we were doing this, COVID hit, and then those funds were released. And so we really got on a fast track that now we have funds available to really do something about the situation that we were having on campus. So the program that we started, the Mental Health Initiative, really went live January of this year. So we're 2 months into to going live. Next slide, please, ma'am. And so with that, there's 4 focus areas that we're really concentrating on. You'll see them here as clinical support, strategic planning, campus mini-grants, and then of course we have to have that administrative support to keep kind of keep all this together in one. So I'm just going to bounce through what each one of those areas are and highlight 1 or 2 of the things that again, as a faculty member or as a staff member, that you might need to know to help a student as they come in contact with you. So we can move to the next slide as far as the clinical support. Okay, ma'am, please. The clinical support, yep. Yeah, go ahead and click on the next slide, please, ma'am. Yeah, the clinical support, if you take a look at the objectives that we have here, we were seeing that the volume of students coming to our counseling center and needing some type of therapy or support, whatever it would happen to be, we just could not keep up with the volume. We had waiting lists that were developing, and that was even pre-COVID. When COVID hit, and really we went online doing telecounseling, really on all of our campuses. We had a learning curve to go with, and also we had, as you saw in one of the slides earlier, we had increased needs for mental health initiatives to take place on our campuses to take care of the volume that we were going through. Next slide, please, ma'am. A group called Christie Campus Health, we partnered with them, and you can move on to the next slide. We partnered with Christie Campus to help manage this volume that we have. One of the keystone elements is the 24/7 hotline. So as students call into their counseling center after 5 and on weekends, and some of our schools, and it depends on how the school wanted it to be set up, some of the schools you call into the regular counseling center, and if they can take the call at that time, they go straight in, or it could roll over to Christie as that call would be forwarded to a clinician that would answer the students' questions, work with them in a clinical type setting during regular work hours as well. But this is really helping with the volume that we're working through. You can see the other services with a wellness hub, much like what the employees are getting through a lot of the services that you just heard, from Karen and Farah about what we do with employees. You're seeing a lot of the same types of of options for students with navigators, individuals that help them find the correct assistance that they need. There's some self-help type programs that they can work through as well, and also help connecting them with resources within the community. All right, ma'am. An example of a landing page. I got to give a little kudos to Valdosta State. Very early on, they developed, this Hope Connected at VSU. What you see here is very branded towards Valdosta State, but this is Christie Campus Health, where you see the 800 number, you see the services that are available out there. And on the right side of the screen, the graphic that we have, that is something that Valdosta is pushing out as far as social media posts and putting posters up around campus. But this is very much Christie campus, but it's branded. As you move to the next slide, you'll see some other institutions from around the state, the branding that they have taken. I kind of like old Nigel there. Nigel looks like a cool dude to hang out with at University of North Georgia, and then live well at East Georgia. So each one of your institutions has some type of branding, but the information is the same, and we're driving our students towards Christie Campus Health, again, to get them immediate assistance as quickly as we possibly can and get the professional assistance that they're going to need. You'll see there in the middle, Be Well at MGA for Middle Georgia, and they have taken this and put it all over their website. So if the students is at the police landing page, Residence Life Counseling Center, Health Center, Dean of Students, one click and you can get to the assistance that you need at Connect College. Yes, ma'am, next slide. The next area that we're working with is strategic planning, okay? The idea behind the strategic planning is, when you think about it, pre-COVID, we were already having a strain on our systems for mental health with students on our campuses, with our counseling centers. So we were already thinking we've got to somehow get a handle on this. That's why the chancellor put the mental health task force together. Part of what we're doing, and as you go to the next slide, you'll see that we partnered with the JED Foundation, and JED has a group called JED Campuses, where they're working directly with our campuses, really campuses all over the country, about strategic planning. The next slide. You'll see here with a couple of the resources that JED has, but just think of it in terms of this, that we have one-time funding for Christie Campus Health and for JED, that $11.5 million that you saw up front, this is one-time funding. So as Christie starts going away, because in 18 months, Christie will go away. They will help with the volume that we currently have, but we have to strategically plan for each one of our campuses and for the system. How do we move forward, not only as Christie goes away, but understanding that we had situations on our campuses prior to COVID ever showing up. We had situations that we really had to address them. So we've got to figure out ways so that we can move forward on each campus, and JED is working with each campus individually, and also will be working with us as a system to how we can move forward as a system to address some of the problems that we're going to continue to have, and how do we manage that? How do we manage those resources? Next slide, please, ma'am. The next area here is our campus mini-grants. As we move to the next slide, you'll see the idea behind the mini-grants. We know that schools are different. When you take a look at Georgia Tech and Georgia State, who are in downtown Atlanta, and then you go to my home campus at Columbus State, that's a little different city situation. But then you move out into some more of our rural areas with South Georgia, you get up into North Georgia and such. The campuses have different resources, and the communities have different resources, and they have different cultures on each one of the campuses. So we recognize that, being unique institutions, there were things that not everybody needed. So we allowed institutions to design mini grants to address some of these needs. In the next slide, you'll see some of the mini grants that we will be funding here really within the next couple of weeks. And these ideas were really coming from our campuses. A lot of it revolves around training faculty, training staff. So you're going to see things like QPR for suicide prevention. You're going to have an opportunity to utilize something called Cognito that helps you with those conversations. Farrah was talking about earlier, how do you have those conversations as a supervisor? How do you have that with people that you are supervising? Well, how do you have those conversations with students who come up to you after class, or they come by the office, and an administrative assistant is that if you want to say that face person that a student first sees. And so Cognito is a training program that's going to help people understand, how do you communicate with individuals? How do you receive them in a positive way and get them to where they need to go? There's some technology updates that need to take place on our campus, and then some student programming that will be running out here pretty quickly as well. So these programs they're going to be hitting the campuses very soon, as they're going through the process right now of final approval and then funding going out. Next slide, ma'am. The last part of the focus areas is the central administrative support. And as we move into the next slide, the idea here was that you've got a nice big bunch of money here, $11.5 million in 26 institutions with 300,000 plus students, and so you need some way to move this in a cohesive fashion, down the road as we're moving the entire university system forward. So as we move into the next slide, you'll see that this is the team of people that will be administrating the entire mental health initiative. Dr. Juanita Hicks is the project sponsor. She's also the Vice Chancellor for Human Resources. Myself, I'm the Associate Vice President at Columbus State for Student Affairs, but I'm on right at a 2-year loan. 100% of my time has been dedicated to the mental health initiative. Dr. Lacey Till over at Augusta University has a lot of expertise and experience with the JED Foundation, and so she has come on to work full-time at this particular time, getting JED up and running. Shortly, she'll be moving back to a half-time position, and then Rich Loftus and then Tracy Arnold Dixon that work, with the system office as far as implementation of programs on campus. It's just unbelievable the support they offer. And then everybody knows Dr. Jones. If you don't, you're missing a wonderful opportunity. You need to get to know her. But as the Vice Chancellor for Student Affairs, she's really our subject matter expert that keeps us on track so that we don't forget that what we're administering, and sometimes at that high level, is for the benefit of the students. And so Dr. Jones, she keeps us on track. As we're moving in the next slide, you'll see that if you want a little bit more information, if you'll go to the home page of the university system, on the top right, where it has initiatives, when you click on that, there'll be a drop down. You'll see the mental health initiative. To get information about what's taking place at your school, on the next slide, you'll see that under institutions, each one of the institutions has a point of contact individual. So you see their name there, and a way to contact them through email. And also there's a link. You remember the Be Well at MGA and Nigel Cares, those landing pages. Each one of your landing pages is right there as well. So if this might be what you do with a student, in just real short order, a student comes up and says, hey, this is going on. You may just in 2 clicks be able to take them directly to the landing page for the resources that they need at your institution to direct them where they need to go. But it's what we're up to. I think it's really cutting edge stuff to come together as a system to address the mental health needs of our students, to work on that the volume issues that we have, to knock back our waiting list of where it's manageable and our students are getting the needed assistance in a quick fashion. But we do have to make sure that as we're moving forward, that we don't take a step backwards, that we can continue to move forward in our strategic planning with JED. And each one of you is very, very instrumental, because at the end of the day, the reason all of us get up and go to work every day is to serve our students, and whether it be in the classroom or outside the classroom, and make sure that they are as prepared academically and they're prepared emotionally to go out and attack the world. We're going to be turning it over to them shortly, and when we turn it over, we know it's going to be in great hands. People questioned us, years back. They questioned us, and we're doing okay, and we know that the people that we're getting ready to send out in this next wave entrepreneurs and professionals that are going to go out and lead our state and lead our country. But these guys are going to do a great job for us. Yeah, please do go to the next slide. You'll see that this was kind of a drinking through the fire hose type of thing. We got things together in November, and then by January 1, we had moved an entire system forward to go live. And we're still tweaking some areas. We're still having some issues that we're going through. And when you have this big a ship to move, you're going to have that. And it's okay. But we're making great progress and doing very, very good work. So as we finish out with the last slide there, I'm gonna turn it back over to, I guess I'm turning it over to Jonathan, but there should be, I think, a couple of poll questions that we're going to pop up and ask you guys to really take a look at. This is going to help us understand a little bit about what you know and how we might better be able to get information in your hands so that you can help our students. So the first one is, so prior to this presentation, had you heard anything about this at all? Okay, so if you'll click on that one and let us know the next question. I see a next button? Do I hit on that? Or are you going to go to the next question whenever you're ready?
It's showing all
Should be
three
all
of the
there.
questions.
One
Okay.
thing, folks, on 3, you may have to scroll up a little bit if you want to say no. So question 3 trims off at the base. So you just may need to push it up a bit although it does sort of indicate that we're thinking you have received communications, but if you have not, scroll up a bit and you'll see the no.
Good deal. Second question is, I know how to find the information. All of you should know how to do that now. You go to the university system page, and you should be able to find that information in the top right-hand corner. So there ought to be a lot of yeses on that one. Yep.
And I did put the link out in the chat as well.
Oh, thank you so much. Yeah, and then the last question that I've received some communication about the mental health initiative, whether it's an email or presentation outside of this presentation, any social media, but you have received something. It wasn't just word of mouth, but your institution did push something out to you so you knew what was going on. So that's going to help us in our marketing as we move forward as well, because you are a big part of making sure that our students understand that this is available to them and where they can go get the information. Right. And so with that, I'll turn it back to Jonathan. Thank you for your time.
And we're sharing the results with everyone now.
Nice.
Great job.
This is good info. Thank you so much. Thank you. All right, sir. Thank you.
Well, thank you. Thank you, Chuck, very much. I appreciate it. I'm going to quickly share that and then stop sharing.
You need me to stop sharing?
Well, I just started sharing my really cluttered screen. Now I've stopped. Do you see?
Oh, you changed your background. Yay.
So I'm not sure I should be proud of this, because it does mean that while the presentation was going on, I was indeed multitasking.
No, that's what I wanted you to do.
But
you don't need to listen to boring on me.
I also, and there's the results. So I don't know if that was shared or not, but that was the results to the slide. So thank you for that. If there are questions, put them in the chat. This has been really fantastic. There's a lot out there. It is a lot to digest. It is a lot to take in. So, and again, it is late on a Friday. So I want to make sure we are mindful of time. So if there are questions, put them in the chat, or go ahead and unmute. You're welcome to unmute and speak up. So I'm seeing none. Farah and Karen and Chip, if they have questions, how do they get a hold of y'all?
I will put my email. I'm going to give you the best USG Well-being, because USG Well-being at usg.edu. This is usually the best way to get a hold of me. But I'll include my
So while Farah's doing that, I'm gonna note something. So when I first started at the system office, my office was literally catty corner from Farah. So Farah and I have known each other for a long time, and they put my office literally. I was the last last office in academic affairs before you got to HR, which was both a signal, but also was a powerful opportunity. And one of the things that I really want to sort of celebrate, and this is sort of getting to this idea that I knew a lot more, I found, about what was going on with HR because I was so close to people who are doing this work. And for those of you on campus who aren't, that's not something you can always necessarily engineer. So it may take a little bit of work, but it has been intensely helpful to me to have colleagues from my side, have colleagues who do this sort of work, who are able to find support. I've been able to get answers to questions. I've been able to identify resources. So I really encourage you to build that sort of bonded and linked network outside of because it's the only way you're really going to find these resources is by sort of developing that sort of open relationship with those folks. And it really was transformative. And it didn't make me a better employee. They ended up having to move me upstairs next to legal. But nonetheless, it really underscores to me, I think, the ways in which by interacting more frequently across the campus, it really made me much more aware of things that went on, even way back when wellness was a building project. And so I want to just sort of thank y'all for the work y'all did. If there are no other questions, again, I'm going to echo this. It's been very helpful. I really appreciate y'all being here. Is there any last words?
Just thank you for everyone. And again, just if I'm always out to partner, collaborate, or even if you just want to say hello, if you just want to be like, I love basketball and you want to talk about basketball, I mean, we got to connect. We got to build our relationships in one way or another. So, I mean, if you just want to say hello or whatever, I mean, I'm always happy to connect and we can build that relationship from there. But it's got to start with something, and a simple email can go a long way. So thank you all for the opportunity.